The final speaker, who is last and never least, is Ebony Johnson. She's a member of the Athena Network and of AVAC's ROAR cadre of US-based HIV prevention advocates.
There's an expression that we can turn poison into medicine, and I think we've all watched it over the past 30 years of the AIDS epidemic and the HIV crisis. We've seen HIV be a pivotal tool to strengthen healthcare systems worldwide. We've seen it be a force of uniting communities and really raising up key issues in human rights. And I think today we stand at the precipice. As we hear results being released on new prevention technology, there's a window that's open. There's a window of possibility to promote, to honor, to respect, and to validate women's health, reproductive, sexual rights. And I think that we must catalyze in the moment. The scientists have come together because we have an expert scientist who's joined us here to say, I stand in solidarity with you, I support you, and I acknowledge that this is not only for women, but it's because women play such a central role in all of our societies, in all of our communities, in all of our households. And so our plea is impassioned not only to the Pope, but to religious leaders worldwide, to global mechanisms, to governments, to say this is a moment for partnership. This is a moment to forward in progress women's abilities to live, to choose, to be free. As we look at treatment as prevention, this is now a place where we've seen new prevention technology has looked at reducing transmission to children, but now we're actually having something that can put the focus on the woman, on her health, and we can see the reciprocal benefits to her children and her partners. So again, we need to exercise this. We need to catalyze on the moment. Treatment as prevention is now a paradigm shift. So many women have been put out of their homes because they're economically disempowered, educationally disenfranchised, because they don't have a voice, because they don't have a whisper, because they don't have this venue that we're in today to say, I can't, I need to, I should be able to. But with PrEP, we can now say that everybody needs to take a responsibility, that that weight should not be shouldered by women in villages who have no voice and who have no other way out. I look to the Pope, I look to religious leaders, I look to each of you in this room, I look to the response of the scientific community coming forward, that we can be in partnership, that we can forward this momentum, and that we can energize the activities of those advocates, that we can energize the momentum here, that we can take our passion and turn it into compassion and change the lives of women. Because when we change the lives of women, we change the lives of the world. I invite you all, stand with us, stand forward for us, and go forward with us. Thank you.
The presentation portion of this, we're happy to take any questions or comments from anyone in the room. And if you can just introduce yourself, please.
Sure. Bakrin from ITBC. I'm trying to, I think I'm the only African man here. So I just, in support, want to say this, because this is a media sort of session. This is a warning to men, and to say that the ground has shifted beneath their feet. They need to look at the writing on the wall, and because they're the main contributors to the misery that women have gone through with regard to HIV, it is time now for them to pay particular attention to these voices that are coming out, saying that it's time to take control of the prevention agenda and not be part of the problem. Otherwise, you know, there's a lot that they're yet to experience, and trust me, I think they know that when, you know, things are not really right, when a woman says things are really not right, things can really be very, very wrong for them. So hey, this is a warning for men to try and do something about the bad things that they've been doing over the past many years.
I'm Steve Litzike from South Africa, Samek Women's Sector. Thank you all. And I think one of the 3 points that I would like to make, following the UN high-level meeting, we're talking about the zero declaration, zero new infection, zero death, zero stigma and discrimination. And what I'd like to emphasize is the point around, if we want to look at PMTCT, we're not only looking at the child, which is #1 priority, but we need mother-baby package. We need to save the women. We need to think about those women that needs to take care of those children that will grow up in a healthy environment. Secondly, is to address, when we're looking at science, we need to look at social issues as well. We need to think about the right of the woman. We need to make sure that that woman is, get prevention packages, that women get treatment, that women access their right. We also need to look at that we monitor and evaluate what is working and what is not working for women, with women. We also need to take in consideration the issues around what is really not looked at. It's the women living with HIV and the women having sex with other women. We need to take in consideration those groups that are marginalized, so we don't want to reinvent the same one. Thank you.
Thank you very much. I'm Helena from Namibia. First of all, before I go on, I just want to say thanks to the gentleman there who was giving a warning to the men, because it's true that they are the cause of most of the problems that we go through. I think women, women and girls know their right, but somehow people around us, they don't care. They don't care about what we feel, what we want to say, what we want to do. They are being ignorant because most of the time they are the breadwinners in the house. So it's either you touch or you don't touch. Otherwise you walk away. Because he knows that if you walk away, he's going to get somebody else because he got something, and we are dying of poverty. Thank you.
My name is Jantini Jacobi and I'm representing UNAIDS. And I would like to say that UNAIDS is very excited about all the new developments for prevention technology. But they will only work when they work for women. And so we need to be closely working together to see what women need and how we can meet their needs and rights. This is an excellent initiative. Thank you so much for organizing it, and we are fully behind it, and we will continue to strive for gender equality and for the rights and needs of women and girls. Thanks.
My name is Anna Sango and I'm from Zimbabwe, and I'm a member of International Community of Women Living with HIV and AIDS. I would like to thank the panelists for saying their views, and I would also like to add and comment on that, saying that as women, particularly as young women, we really need the support of people. We really need the support of the Pope. We really need the support of all other religious leaders. We also need the support of all those people that have got powerful voices, because without your support, we can't do this. So we really need you to support, to stand behind us and be there for us, because we really want initiated, innovated HIV prevention and protective methods. So we really need you to support us. Thank you.
With that, I know some of our speakers have to move on, so I will, is there one last remark here?
Julio, would you like to add your voice?
I don't know how to say no to the microphone, of course. But, I'm not going to restate the obvious. I mean, you said it better than I can, and you're better authorized and qualified to say it. But it doesn't matter what scientific new development we bring to bear, if it doesn't become available to you, the people that actually need it the most, we're not going to have the impact that we want to have. And Michelle Sidibe spoke very clearly about the need to close the implementation gap. As you know, that has been my theme now for a number of years. I'll be the last one to say we're going to stop the science. But to be honest with you, we don't need any more science to stop the epidemic. We know everything we have to do. The question is, are we going to have the political leadership to do it? And I feel horrible because as a Roman Catholic that I was born, here we are in Rome, in a situation where we haven't received the audience by the Holy See that we should have received. And as a Canadian that I currently am, I got to tell you that my Prime Minister is ignoring you, is ignoring us, is ignoring everybody, and we cannot tolerate this anymore. So I unite my voice to yours, asking for the leadership of this world, whether it's religious or political, to deliver on the prevention promise that the science has now delivered, and make it a reality for all of us.
From your mouth to God's ears, as they say. From our mouths. There's one more comment, and then people on the panel and the women with the placards are demonstrating allies will be available for questions afterwards.
Hello to everybody. I am from Tajikistan, and about 2 years I am a HIV positive woman. I want to pay your attention to those questions that there are a lot of funds come to our country, but finally the women don't access these funds. I want to say that one example of that, we have not access to medication. The life is really hard for the woman and for their child. I want to say that the woman with HIV should be participate in the monitoring of the program and spending money of the international agencies.
Thank you very much to everyone, speakers, panelists, and participants.